1, 2, 3.
Welcome to this series of webinars on COVID-19, recorded on behalf of the European Respiratory Society and the Prepare EU Pandemic Preparedness Project. We have a number of excellent speakers from European Centre for Diseases Control, the WHO, and other clinical and research experts who will speak on a variety of topics. We will continue to update the series. We're very grateful to you for contributing questions via the website and social media. We have divided these questions into themes such as virology, global surveillance, infection control, protection of healthcare workers, clinical care and therapies and their outcomes, and vaccine preparation. Our experts will address these as relevant in their presentations or subsequently. Just on the clinical side, we were very interested to see the mild infection in children and your series on infants. Do you have any speculations why children and young people are less affected?
I suppose maybe one of the reasons may be the immune system is not mature. So in an immature system, because as you know, the attack of these coronavirus is cause, I suppose, overreaction of immune function. So because sometimes, in addition to the invasion, the damage of virus directly, and also cause a very big change of immune function, or usually is overreaction. So that's a release of a lot of cytokines and so on. This is causing cytokine storm, and then which in turn would damage just like suicide. Just like body. I suppose it's something. But in children or in infant, their immune system is not that mature, so not fully developed. Maybe one of the reasons.
Okay.
We have also seen some of the patients at the very small percentage of children. They had also had some severe situation, but very few.
Okay, and quite different to influenza then in the infants, really.
I don't think there's too much difference in that. Yeah, because some of the influenza like. Also cause some death in children.
Got it. And going to the other end of the spectrum, those who are much more likely to be infected, those with chronic conditions, I was particularly interested, I think you said about 6.3% of people with chronic respiratory disease. Are these mainly COPD patients, smokers, asthma patients?
It doesn't matter whether they are smoker or non-smoker or ex-smoker. So I haven't seen too much difference in between smokers. So this fact. So actually, some of the smokers also infected. So there's no that kind of things from our data. Okay,
but the outcome was quite poor with the combination.
I suppose in cancer patients, cancer is most difficult to treat, and also I think hypertension and COPD as well, and some patients with diabetes.
Do you think the hypertension is just a marker of other cardiac disease or age? Because in its own right, hypertension is surprising in a way.
Oh yes, hypertension, because the original data is not that detailed. We got the data from 553 hospitals. They just majority of the patient they just provide one patient.
Yes.
And they put the whole process. But it's really in a hurry. So I don't think the history is taking really clear in detail. So of course they have I think the COPD patient, the percentage not as low as that. So in our data with 199 patients, that's the beginning of this outbreak.